been my next guest, the Vice President of the United States, Mike Pence. Welcome back, sir.
Great. Good to see you, Chuck. Thanks.
Good to see you. Happy Day 101. Let's get into some details. We were talking about health care a little bit. I know you've been working hard on this. You've been in many ways back and forth. People see you ducking into different congressional offices, doing negotiations, having to do, and one of them has to do with this so-called MacArthur Amendment that some moderates on the Republican side are concerned about. Let me play for you some sound of that and get you to respond.
I wouldn't be surprised if they pass something, but I'm not for it. I'm just telling you.
It could affect people with pre-existing conditions, and that it'll make insurance probably much more expensive for them, and in some cases perhaps inaccessible.
It doesn't help the people I represent.
You've heard this concern, which is that if you essentially eliminate these essential benefits, you give the states the opportunity to essentially take out the protection for pre-existing conditions, or if you do keep it, making it so that those folks are guaranteed to be paying a lot more for health insurance. And if that's the case, how do you pass this thing?
Well, first, before I get to that, let's begin with the fact that Obamacare has failed. I mean, it literally is collapsing all over the country. Insurance companies are fleeing from the exchanges.
Not a lot of folks agree with you on that. That is a very debatable point, Mr. Vice President.
Not
in fairness,
on,
it is a very debatable point. But let's go. I'd like to get into the
states around the country where literally people in half of the state have no choice for health insurance at all. People have seen their insurance premiums skyrocket. The American people know that we need to repeal and replace Obamacare, and President Trump, from the first day of this administration, has been working every single day to keep that promise to the American people. And I have to tell you, the legislative process is often slow. Nobody knows it better than you.
And yourself, you were a member of Congress.
What's the old saying? If you like sausage, don't go where they make it, right? And we're making law here, and we're unmaking one of the worst pieces of legislation in modern American history. And on this point, you know, Congress obviously wasn't ready to begin the process of repealing Obamacare a little more than a month ago, but I think we're close. And it is owing to the fact that you're seeing members of Congress coming together to repeal the onerous taxes and penalties that people pay if they don't have insurance in Obamacare, to expand health savings accounts, to give governors like my friend John Kasich the ability to have all new flexibility to improve Medicaid for their most vulnerable citizens. But we're also keeping our promises to protect people who have pre-existing conditions.
But besides protecting them, are you going to be able to prevent their premiums from skyrocketing? That's been the concern, that if you isolate them into risk pools, that the inevitable impact is the rise in premiums. How do you protect that?
Well, I think the way you protect that is, first and foremost, you make it very clear, as we did in the first bill, but with the amendments that have taken place in the last several weeks and come forward, it's even better still, that we're basically borrowing an idea from the state of Maine that has seen a significant drop in premiums for people on their health insurance, because you take people that have pre-existing and costly conditions and put them into a high-risk pool, and you subsidize that so that it is affordable to those individuals. And so you're guaranteeing coverage for pre-existing conditions, and the flexibility that you're referring to in this latest MacArthur Amendment, states can only apply for that waiver and flexibility if they have either a federal or state high-risk pool that guarantees that people will be able to have coverage, and it'll be affordable.